Hello everyone, I'm Tom Parkin and welcome to Colorado Health Matters, where we educate and inform you about treatment options now available in the ever-changing world of medicine. We have teamed up with Colorado's best physicians and healthcare facilities to explore the fascinating world of today's healthcare. So, stay with us because there's nothing more important than your health. The hip joint is a ball and socket joint that allows motion and gives stability needed to bear body weight. The hip is one of the most stable joints in the body, but because it bears your body weight, it is more likely to develop problems because of the extra pressure leading to hip replacement. Dr. Joseph Assini is a board-certified, fellowship-trained orthopedic surgeon and tells us about the latest approach to hip surgery.
My practice focuses mainly on replacement of hip and knee and revision of those joints that have not gone well. So the number one symptom that I would be seeing would be osteoarthritis. Arthritis is a kind of a catch-all term for just inflammation of a joint. It can be caused through injury. It could be because people have aged, they have active lifestyle. We also have inflammatory arthritis, and those are things like rheumatoid or psoriatic arthritis. All of those eventually just lead to destruction of the joint architecture. And at the end of the day, if you failed your medical treatments or your conservative treatments, then most people are leaning towards joint replacement, and that's where we would come in. So typically when I first meet a patient, the first thing I want to get an idea of is what their goals are. So for different patients, those are different things. So some patients, their goal is to complete 18 holes of golf. For other patients, it's that they don't want pain when they're at the grocery store. And from there, we can develop a treatment plan that would work best for them. Joint replacement has become very successful over the last 15, 20 years. The materials have gotten better. The techniques that we use have improved. And I would say now about 70% of my patients are going home the same day of their surgery. So for me, a rapid recovery total joint is something that I have a lot of passion for. And when we say rapid recovery, that's individualized to a patient. So some patients, that's 3 or 4 hours, they're up and out the door. Other patients, that's one night, stay in the hospital until they're ready to go home. So we can tailor that program for you as best as possible. Hip replacement, not a new surgery. It's been around for a really long time, and it is probably the most successful medical procedure that we have in the history of medicine. What's changed recently is how we do the hip surgery. So initially hip surgery was done, or hip replacement surgery was done through big incisions, really opening up the body to see everything. Minimally invasive surgery started to come around. The problem with the minimally invasive surgery is that if the surgeon can't see very well, they can't put the implants in a really good position. And putting implants in a good position, especially on a hip replacement, is of the utmost importance. With an anterior-based surgery, which is probably becoming one of the most popular ways of doing surgery, it can be hard to visualize. And secondarily, the incision is done in a way that it's in line with the femur, so up and down. And this sometimes has some trouble healing. And if you have a wound that is not healing as well or healing issues, that can increase your risk for infection. Okay, so we've thought of an idea where we change the orientation of these incisions, so we make it flatter, so basically we call it along your bikini line or transverse base incision. The idea behind that is it's now made in line with the healing of your normal skin. So we're not cutting against those lines. The second problem with is visualization, like I mentioned, so we have healing and visualization, is that we adapted a portal, which is a small tube. It's about as big around as a Bic pen, and we use a special instrument to insert that through the patient's thigh. It makes a very small stab wound. And now we can prepare our socket through the cannula, which allows us to see much better. So instead of having big instruments and reamers, we call them, to prepare the socket through that small incision, we actually put them through the cannula so I can see much better. So we have our healing benefit and we have our visualization benefit. The third benefit that we've been seeing from this is that the patients are experiencing much less numbness. So unfortunately when you do an anterior hip surgery, we encounter some nerves. And this can give patients numbness on their thigh, and it can be bothersome for about 20% of people. In the study that we're running right now, we're seeing very low rates of numbness in these patients, and I think it's because of the orientation of the incision. So our visualization, our healing, and we think numbness are improved with this anterior path procedure. So I developed it with 5 other surgeons across the country. We've been doing it since 2019. We have a large database, and we're about to start publishing our first research data points on it. And we presented it sort of really all over the world. It's been presented now. So I think it's growing in its use, but I have to say I'm still the only one locally in Colorado that's doing it. And I think our patients are really happy with the procedure.
Dr. Assini's practice specializes in hip and knee replacement. and the revision of failed or painful hip or knee implants. One of Dr. Assini's main focuses is on rapid recovery total joint replacement, which strives to get patients back to full function as quickly as possible. National Doctors Day is March 30th each year. As we join in celebrating and remembering all those doctors who have impacted our lives, we wanted to feature a program that is here to help physicians. Colorado Physician Health Program, CPHP, is a nonprofit organization which provides peer assistance services statewide for licensed physicians, physician assistants, and anesthesiology assistants of Colorado. Let's find out more.
CPHP was established in March of 1986 as an independent, nonprofit entity. Our primary mission is to enhance the health and well-being of healthcare providers across Colorado. This goal is achieved through comprehensive services that include evaluations, treatment, referrals, support, education, and of course research. At CPHP, we cater to a wide range of professionals, including physicians, physician assistants, anesthesiology assistants, and trainees addressing issues such as medical conditions, psychiatric disorders, substance abuse, and personal challenges like burnout, family strife, stress, or career-related concerns. Most importantly, these services are offered at no cost to licensed Colorado healthcare professionals and are strictly confidential. Confidentiality is a cornerstone of CPHP's operations, ensuring trust and privacy. Adhering to stringent guidelines, CPHP ensures the privacy and anonymity of its clients in compliance with HIPAA, as well as all relevant federal and state legislations, including the Colorado Medical Practice Act. The confidentiality standards maintained by CPHP are in line with those required of all licensed medical practitioners. This includes critical situations where there is a risk of harm to the individual or others, or in cases of direct violation of the Medical Practice Act.
Let's learn about some of the services CPHP provides.
CPHP has true peer assistance services, physicians helping physicians. We help individuals who have any problems that would affect one's health, such as emotional, psychological, or medical problems. CPHP provides diagnostic evaluation, treatment referral, as well as treatment monitoring and support services. CPHP believes that early intervention and evaluation offer the best opportunity for a successful outcome and for preventing the health condition from needlessly interfering with medical practice. We are pleased to offer the Doc-to-Doc Wellbeing Consulting Program, a joint effort between CPHP and the Colorado Medical Society. Any physician, physician assistant, anesthesiology assistant, or trainee can access free consultation sessions with a peer physician for any issue affecting well-being.
CPHP also provides education about the health and well-being of physicians and physician assistants. We work with employers, including hospitals, health systems, and practice groups around ways to optimize healthcare settings to reduce physician distress. In addition to these services, CPHP engages in groundbreaking research about the challenges of physicians staying well. The core values of CPHP are threefold. First, well-being. We are committed to fostering a culture of health and wellness, not only for our clients, but also within our organization. Second, excellence. Our aim is to surpass the clinical and professional expectations of the Colorado medical community through superior service and expertise. Lastly, our service. We prioritize the needs of our clients, constituents, donors, and team members, ensuring that each interaction is marked by quality and care.
Colorado Physician Health Program is dedicated to supporting the health and well-being of Colorado's medical professionals, upholding a high standard of confidentiality and excellence in its services. Please don't hesitate to contact them or visit their website for more information. Audiology is ranked as one of the top 20 best professions in healthcare. Doctors of audiology study hearing, balance, and disorders of the ear. A main focus of audiologists is to evaluate and treat those with hearing loss proactively with a multitude of technology options. Dr. Natalie Phillips at Audiology Center of Northern Colorado has worked as an audiologist since 1996. She tells us how she and Dr. Hannah Galloway set their practice apart from other private practice audiologists.
At the Audiology Center of Northern Colorado, we provide the most comprehensive care while providing a one-stop solution for all your audiology needs. We help newborns to elderly and are the opposite of corporate health care. We are a local, independent, women-owned business and are proud to have you as our patient. What makes us unique is that we are a practice that is comprehensive and participates in the full scope of audiology. What that means is that we do not just do diagnostic testing and fit hearing aids, but we do what other private practices do not do. In terms of experience, I have over 28 years and Dr. Galloway has over 8 years. And when we opened our practice, we decided to keep the ability to see any and all patients to help them with their diagnosis. This includes the following that other practices may not provide: tinnitus, sound sensitivity, balance disorders, auditory processing, cochlear implants, bone-anchored hearing aids, and brain concussions and head injuries.
We believe in caring and comprehensive services with a strong focus on giving back to our community. I volunteer once a year for a nonprofit called Faith in Practice. We go to Guatemala for a week every year and provide healthcare services. So I provide audiology services, and I'm on a team with many other people that provide other healthcare services. So we source donations. Both Faith in Practice sources donations, and then me and the other audiologist I go with personally. Here, our patients are wonderful, and they will donate their old hearing aids to us so that we can take. We set up in a rural village and then do 3 full days of clinic. So it's like 1 setup day, 3 days of clinic, and then 1 kind of tear down and go home day. We treat patients as a whole. We care for people the way they deserve to be cared for, as if they were our own family. We are a private, independently owned practice who can take the time to listen to your needs, because what we care about is you.
I love being able to decide how we see patients and how we treat our patients. And I think that definitely Dr. Galloway and I agree that because we're not a corporate healthcare system, that we can decide. I love that we're a small office. I love that we have all women in our office. And I love that we trust each other and have a great cohesive environment. And so it's something that you love to wake up every day and you're happy to go into the office. And that's something that people just dream of.
At the time of my first visit with Dr. Galloway, I was getting no benefit from hearing aids. I had lost most of my conversational hearing and relied on lip reading to communicate. Dr. Galloway helped me to get my first cochlear implant surgery, and I have since gotten bilateral implants. They have also provided client-centered, personalized care to my brother, my sister, my mom, and my mother-in-law. Both Dr. Galloway and Dr. Phillips have gone above and beyond, helping both my moms, gradually adjusting their hearing aids until they receive maximum benefit. We couldn't be happier with Audiology Center of Northern Colorado.
At Audiology Center of Northern Colorado, their motto is caring, comprehensive, community. Commitment to excellence. Family Holistic Dentistry is a caring and gentle holistic dental practice. Their team includes 4 dentists, each with their own area of expertise, providing a comprehensive approach to patient care. Their personal service is enhanced with state-of-the-art technology, biocompatible materials, and dedication. All of this sets their practice apart.
Yeah, our practice is Family Holistic Dentistry. We have different approach of dentistry in the sense that we always look for the root cause, everything that happens in the mouth, because everything is related. So sometimes we see things in the mouth as a consequence of anything that is going in the body, or vice versa. So what we do is we work with these practitioners. We work with medical functional doctors, chiropractors, acupuncturists, nutritionists, naturopathic doctors, and they treat our patients in that area just to get a good terrain for us to work our dentistry. And it has been really good because like that we really approach the whole thing. For us to also to see the root cause, we have this a technology, the CBCT, which is a computerized tomography. And we can see infections that they are really hidden we cannot see them with the regular sensors. We have lasers in our practice as the PHOTONA laser. This laser has the MD jack and the erbium, and is used for many things. So we use it to remove decay, we use it to disinfect, we use it to cut the gum when we're preparing an implant or when we have a lot of gum over a preparation. We use it in our cleanings just to disinfect the pockets and also for photobiomodulation. So we use it every day in our office. So other thing that is really important for our practice is that we have biocompatible materials. So we do tests to see if they have any reactions or allergies, and then we choose our materials based on that. And these are blood tests. And it's really good because then people know exactly that they won't react to that. So something that we use is ceramic implants. So we place ceramic implants because they are more biocompatible than the titanium implants for many people. Not for everybody, but for many people. So we want to have alternatives to the regular dentistry. And that includes ceramic implants instead of titanium, cements without BPA and without fluoride. We don't place amalgams, so when we remove it in a really safer environment for our dentists, for our staff, and for our patients. So we use vacuums and we protect because the mercury vapor is a thing. And there is a lot of studies how bad it is for your health. And nitrous is an aid that we have to make people a little bit more relaxed. And they just very relaxed during the appointment, and we can use it for any procedure. It could be restorations, crowns, extractions, ceramic implants. It depends for what they need it for. It can be used for anything, even a cleaning if they want to. We really enjoy this approach. It's more compassion, more patient-centered. We have a lot of continuing education. We have a lot of the state-of-the-art technology, and we really work as a team. So we really enjoy that.
Growing up, my family didn't go to a holistic dentist, and to be honest, didn't have the best experience with my family dentist growing up. I felt like there's a lot of unnecessary work that was done throughout the time, and it didn't really take into account a holistic and a whole picture. It's more isolated in on just the tooth. And so I think that's a big aspect of the holistic dentistry, is just the aspect of caring for the patient, and yeah, having a more comprehensive outlook on health too, I think is really important.
Dr. Burke has merged her love of holistic health and dentistry. Her philosophy is to educate every patient in order to provide awareness of the importance of maintaining good oral health, as the immune system starts in the gut and the gut starts in the mouth. Pathways Speech Therapy is a private practice offering comprehensive services for adults with communication, cognitive and swallowing disorders, including consultation, diagnostic evaluations, and individualized treatment programs. Founded by Devon Chisholm, a licensed medical speech-language pathologist with years of experience, Pathways Speech Therapy was established to meet the needs of the growing communities in which it serves.
I'm Devon Chisholm, speech-language pathologist since 2009 and owner of Pathways Speech Therapy. We pride ourselves in being an ally in healthcare for patients and their loved ones. We do this by having the highest standards of evidence-based practice and therapy interventions, and by communicating closely with caregivers and other healthcare professionals. This is paramount to a patient's improvement and ongoing success. Treatment is focused on increasing functioning at home and in the community to promote successful return to work, ability to participate in activities of choice, and overall well-being. We have flexible therapy settings to meet the needs of each patient. So therapy is offered in my office, in your home, or through telehealth. Speech-language pathology is a unique component of healthcare. We have expertise in the areas of motor speech, language, voice, cognition, and swallowing function. Disorders impacting these functions generally result from neurological conditions related to acquired brain injury, such as tumor or stroke or seizures, neuromuscular conditions such as myasthenia gravis and muscular dystrophy, and neurodegenerative diseases like Alzheimer's, dementia, Parkinson's disease, and ALS. At Pathways Speech Therapy, we believe in following scientific research to apply the principles of motor learning and neuroplasticity when appropriate for optimal outcomes in treatment. In addition to neurological etiologies, certain disorders treated by SLPs can be linked to vocal misuse, intubation, respiratory issues, heart issues, tracheotomy, reflux, and cancer. Conditions are often intertwined with mental health, visual, and auditory impairments. I provide speech therapy to those dealing with complex issues and collaborate with other healthcare professionals. As hearing loss is associated with cognitive decline and communication impairment, I also offer hearing screenings as part of my service model.
Devon believes staying ahead of the curve by using the latest technologies. Let's learn about the latest diagnostic equipment that she uses for swallowing disorders.
Swallow function is a complex system involving motor and sensory nerve responses, muscle movements, air pressures, and coordination of breath. Yet, we swallow mostly without thinking about it until there's a problem. Problems can exist in the oral phase, pharyngeal phase, or esophageal phase of swallow. A fiber optic endoscopic evaluation of swallow is an instrumental diagnostic test that I perform. With this, I'm able to directly see what's happening internally when a person swallows food, liquid, or pills, and also allows for assessment of the soft tissues and for clinical signs of reflux. All very important in order to give recommendations and develop an appropriate plan of care for the patient. FEES uses a small, flexible, and fiber optic tube called an endoscope. It has a high-definition camera and light source attached to it. I pass the endoscope transnasally above the floor of the nasal passageway into your throat. It sits above your epiglottis for most of the viewing and gives direct view of a person's pharynx, larynx, esophageal opening, and top portion of the trachea. FEES is a very safe, accurate, and precise test that can identify if aspiration is present and what the source of the swallowing impairment is. I use the very latest state-of-the-art equipment, which is portable and lightweight, so I can perform my test in my office, at a patient's home, or at a doctor's office. I inform your doctor of the FEES results and work with you to develop a plan of care. This may include modifying foods or liquids, training and strategies for safer eating, and muscle strengthening. Pathways Speech Therapy also offers neuromuscular electrical stimulation, which retrains the brain's pathways for swallowing.
This process is helping me overcome the most frustrating and debilitating issue I've ever had to deal with, and that is memory loss. And I highly recommend Devon and her processes that she teaches to anyone needing help in that area.
Pathways Speech Therapy's philosophy is a blend of compassionate care with treatment that works. Whether it is a new problem or a chronic condition, they can help you find the right neural pathway forward. The upper cervical region is a unique area of the spine. These vertebrae can misalign in such a way as to interfere with the brainstem and spinal cord as they exit through the floor of the skull into the neural canal. Special attention is given to the first two cervical vertebrae, the atlas and axis, because they are the most unstable part of your spine and most prone to injury. There are nearly 300 different ways the upper cervical area can misalign, so there are no cookie-cutter corrections to this part of the spine. Dr. Christina Coblish and Dr. Ryan Moskew are a husband and wife chiropractic team that specializes in the Blair Upper Cervical technique, focusing on gentle approaches to address this sensitive area.
At Upper Cervical Chiropractic of Boulder, we utilize the most specific form of chiropractic care, Blair Upper Cervical. This technique focuses on making corrections to misalignments in the top part of the neck where the brainstem sits. This technique is done without the use of twisting, popping, or cracking in the neck. The adjustment is precise, light, and very quick. The amount of force that we use is very minimal, and our patients appreciate that we do not have to twist the neck in order to make corrections. Our technique allows us to be as specific as possible when delivering the corrections, which leads to incredible results. The most common things that we help patients with in our office are neck pain, upper back pain, headaches, migraines, shoulder injuries, TMJ disorders, tinnitus, and vertigo. Upper cervical care is also ideal for those who have had lower cervical disc injuries or fusion surgeries to their neck already. As we stabilize the upper cervical spine, it will strengthen the rest of the neck.
At Upper Cervical Chiropractic of Boulder, they use the latest 3D technology in their practice to analyze the upper cervical spine. Let's learn more.
Our goal is to be as precise and specific as possible when making corrections on a patient. We capture CBCT images, which produce a 3D rendering of the upper cervical spine. This scanner creates an amazing 3D model of your cervical bones. This shows exactly where your bones are sitting, and we can then use this to make appropriate corrections needed, one bone at a time. We also use a differential paraspinal thermography scanner, which allows us to do a before and after scan at every visit for each patient. This allows the patient to see exactly what they look like when they came into the office and how they have changed after they've received treatment that day. This also holds the practitioner accountable and verifies the change that we are intending to accomplish is actually taking place. With each visit, the patient knows that their body is functioning better than before they came in. More importantly, the thermography scanner tells us if you even need an adjustment that day.
One major goal in upper cervical care is to teach the spine to hold the corrections that we give you. Because upper cervical chiropractors cut out virtually all of the guesswork by using objective scans each treatment, delivering precise corrections to just one bone at a time, and then evaluating, this means that we have less visits for our patients over the course of their care.
About 2 years ago, I had a very serious migraine that I could not get rid of. I went to the hospital multiple times for it, and each time they would just pump me full of migraine cocktail and send me home. I've got MRIs and CTs done of my head, and nobody could figure out what was wrong, so eventually I just decided to come here, and after about 2 or 3 visits, my migraine was gone, so it was literally like magic.
Dr. Christina Coblish and Dr. Ryan Moskew at Upper Cervical Chiropractic of Boulder are on the forefront of chiropractic care. Their purpose is to deliver specific corrections to the upper cervical spine. This helps you achieve your health goals by stabilizing your spine with as few corrections as possible. Well, that's our show for today, and I hope you found the information helpful. If you'd like to see any of the segments from the program again, please go to our website at coloradohealthmatters.com. For everyone on the program, I'm Tom Parkin. Thank you so much for watching, and please join us next time for another edition of Colorado Health Matters.